Reynoso, and Dr. Henning Ansorg, the county's public health officer. Following their updates, we will open it up to questions from the news media. As a reminder, this press conference is being interpreted in Spanish by Carlos Saracedo and in American Sign Language today by Julia Townsend. Videos of the press conference will be available shortly after the conclusion of this press conference in English and Spanish, posted on the county's YouTube channel at CSBTV 20. And with that, I will turn it over to County Public Health Director, Dr. Vaughn Do Reynoso. You're muted, Vaughn.
Thank you, Gina, and good afternoon, everyone. I'd like to begin by sharing with you a presentation. If you can bring that up, that'd be great. So just a quick reminder about where we're at with our local vaccination efforts. In Santa Barbara County, we are still currently vaccinating the phase 1A, which is the healthcare workers. We are also vaccinating the 75 years of age and older. All the appointments at the public health community sites are booked full at this time. We will create appointment slots as vaccine availability comes to our county. We are currently not vaccinating 65 to the 74 years of age, and we are currently not vaccinating phase 1B. Next. So community members 75 plus, again, just as a reminder, will be alerted of open vaccine appointments when they sign up for our vaccine newsletter. So please share that for community members to sign up to receive current information at https:/publichealthsbc.org/vaccine. And you can also find this information on our webpage. Or you can call our call center at the 211 and select option 4. We have staff on standby to assist you. Our approved medical providers will also be contacting their eligible patients to schedule the vaccines. Next. So again, we are following the state's priority by giving frontline healthcare workers with direct patient care first priority. And then the 75 plus, unfortunately, even though the governor has sent information to the community statewide that persons 65 and over are eligible, unfortunately, because of the vaccine limitations in our county, we are not vaccinating 65 plus right at this moment, but coming soon. And those at risk of exposure at work because of the work in the following sectors: education, childcare, emergency services, food and grocery, and agricultural workers. We would like to begin vaccinating our essential workers, but again, because of our limited vaccines in our county, we are holding off, and we will notify our community when their turn is here. Next, I'd like to illustrate how vaccines come into our county. And it begins with the federal government. There are two pathways. The federal government contracts directly with CVS and Walgreens to offer vaccines at the long-term care facilities. The federal government also allocates vaccines to the state of California. And our state offers us a set vaccine number each week. And we, in turn, when we receive that allocation number, we offer it to our community providers, and we retain some as well for our public health community vaccination sites. So far, we've allocated 81% of our county's allocation to our community providers so that they can offer vaccines to their patients and the community who are eligible. And we retain the 19% and distribute them in our three vaccination clinics in Santa Barbara and in Lompoc, as well as in Santa Maria. Um, and I'd like to pause and just provide you with a little bit more information. So, since January, at our public health vaccination sites, we've offered 11 clinics, and through those clinics we've offered into arms of community members 6,083 doses, and that includes the estimate numbers for today. This week, about 75% of the appointments have been for 75 plus years old. And it takes roughly about 85 to 100 staff and volunteers to operate each of our community vaccination clinics. And we just want to thank our community volunteers for the great partnerships that we do have. This week, we were able to offer vaccines to a lot of community members who had um, functional needs, who were disabled, who had difficulties walking around or difficulty standing. We were there. Our volunteers and our staff were able to assist our 75 plus community members to get their vaccine in a safe and efficient manner. We are averaging about 100 vaccines per hour at our vaccination sites, and we're doing well, even with the light rain. Although we do anticipate with the rainstorm coming next in the next few weeks to be a challenge, but we are learning to be adaptive, and getting better and more efficient in our operation regardless of the weather. And I share that, and I just want to also give a great appreciation to the public health vaccination team and our volunteers for the great work that they're doing in the community sites. Next, I'd like to share with you what I mean when I say that 81% of our vaccine has been allocated to our community providers. So these providers include community clinics, it includes private clinics, it includes urgent care, it includes various healthcare providers. It also includes our hospitals and our retail pharmacies as well. So in partnership, these entities are offering vaccine opportunities to the eligible members of our Santa Barbara County. Next. COVID by the numbers. Today, we are reporting 238 new cases, 11 new deaths, unfortunately, 2,176 active community cases, 187 hospitalized with 50 in the ICU, and 0 adjusted Santa Barbara County ICU availability. But I'd like to also share with you some good news. The data that we are running is showing that our case rate and test positivity have peaked on January 9th and have since decreased. While case rate and test positivity remain high, they have been decreasing in the last 13 days. Case rate decreased by over 20%, and testing positivity decreased by 13%. And this is really encouraging news. However, I do want to share that we are not out of the woods yet. We need everyone to maintain their diligence in all of the precautions, all of the tools that we've set forth. because we still have hospitalizations. We do expect a high number of COVID 19 hospitalizations for the next few weeks to come because of our high case rates. We, as I shared just a few minutes ago, are unfortunately experiencing a large number of deaths. So, over the past 3 weeks, nearly three times as many people have died compared to the peak weeks over the summer. And of course, while our case rate and testing positivity have decreased, they are still very high, denoting that there is substantial presence of COVID 19 in our community. So it is really important to remember that and maintain your due diligence in wearing your mask, maintaining your 6 feet, at least 6 feet distance, and limit your gathering with those outside of your household. Another note is that when we look at the surge that occurred this summer, it took about 3 months for the case rate and the testing positivity to substantially decrease. Given the significantly higher, the phenomenal, uh, uh, seriously steep winter peak, we are anticipating that it will probably take a lot longer for the widespread transmission to stop. Next. So I'd like to again really want to applaud our community for their diligence. Um, this is really good news that I'm sharing with you, but it's really to a call again to action to maintain all that you have learned just a little bit longer. Um, Please vaccinate when you are eligible, when it's your turn. Continue wearing your mask, continuing to watch your distance, continue to wash your hands, and please continue waiting on gathering and limit really your leaving the household to only for essential needs. Thank you. And with that, I would like to introduce you to Dr. Ansork, our County Health Officer.
Thank you, Director Dorenoso. Good afternoon, everyone. At this time, it seems that we are seeing the full effect of the activities over the winter holidays that led to very high hospitalization rates, ICU needs, and more deaths. Our hospitals are still near or even at surge capacity, and our ICUs remain very strained. Despite these overall concerning numbers, it appears, as Dr. Do Reynoso just pointed out, that our high numbers have sort of peaked over the last week. We are hopeful that we will see a slow reduction in cases. Now, however, this will take weeks. In the meantime, it is absolutely essential to keep social distancing, to stay with people in our household bubble, and to wear a mask at all times when not alone. Due to this very long pandemic, the virus had ample opportunity to change and mutate. As many of us have read in the papers or heard on the news, there is a very concerning new mutant virus, especially in England. It's also called the B117 mutation that has basically replaced the old natural form of the virus. This new mutation is much more able to stick to tissue receptors and therefore infect people much faster. It is thought that this virus needs less virus material to be actually infectious. Experts have not found conclusive evidence that this virus in itself is more deadly. However, if a mutant infects more people, that results in more hospitalizations, and that again causes overall more deaths, even if the virus as such is not necessarily more deadly. In California, we've had very few of these mutations so far. Having said that, another mutation has been found in at least 2 large outbreaks in a Santa Clara area in the last few weeks. This is also called the L452r mutation. Again, this virus has improved its ability to infect people. So we anticipate that these new mutated viruses will replace the old virus over the next couple of months. We will learn more about this and we will update you on a regular basis. We are in contact with a research lab locally that will help us monitor the situation in Santa Barbara County to see what types of mutants are currently spreading. Fortunately, our current vaccines from Pfizer and Moderna are both effective against these new virus strains. In the meantime, we continue with our mission to vaccinate as many people as quickly as possible. We do have strong collaborations with the hospitals, the clinic systems across the county, and the pharmacies to help vaccinate as many people as possible. At this time, we have administered about 20,000 doses in Santa Barbara County, and our experience so far has been that the vaccine is generally well tolerated. I personally am aware of 2 allergic reactions that required medical care following the vaccine. However, the patients having the allergic reaction did not suffer any lasting harm. In both cases, the patients recovered quickly with the appropriate treatment. I can report that the initially recalled batch of Moderna vaccine that was recalled last week or early this week has since been cleared by the state health department. No one in Santa Barbara County had received this vaccine. Unfortunately, the hoped for steady supply of vaccine doses to Santa Barbara County and the rest of California has not yet materialized. We are hoping that in a matter of 2 to 3 weeks, the availability of the vaccine to us will increase substantially. We encourage everyone to sign up on our website to receive personal updates and information on the vaccine rollout to their email. We want to make sure that the persons who have the highest risk of suffering really poor outcomes from this infection are the first in line for the vaccine. That means the elderly, and generally also people over 65, or younger people with underlying conditions. Even the over 65-year-olds are a very large group of people. It will take several weeks or months to cover them all, even if we have a lot of vaccine. We appreciate your patience and your understanding as we together make it through this constantly evolving vaccination process. I urge everyone to please get the vaccine once it's available. Please avoid all risky behaviors like mixing with people outside of your household, travel, or other gatherings, especially indoors. Please always keep at least a 6-foot distance from others when you're outside. And protect yourself and everyone around you by wearing a mask. Thank you.
Thank you, Dr. Ansorg. We will now go to questions from the media. Up first is Blake Devine with KUIT, who will be followed by Tom Bolton at Newshawk. Go ahead, Blake.
Hi. So just my first question with 20,000 doses being administered, isn't that only about 2% of what's needed in our county to be as fully vaccinated as possible? And why at this point are there only limited vaccinations taking place in the county?
Well, the answer is simple, because we don't have product. You can only inject what you have in a dose, in a vial. And we are completely dependent on the supply chain that's coming directly and is organized by the federal government.
And then another question for me, with obviously the new presidential administration coming in this week, what are you expecting with vaccine rollout with the new administration?
Well, we've heard so far that the production is around 1 million doses a day. If I do the math on a napkin, that would mean that California should receive around 120,000 a day. And then a county of the size of Santa Barbara County could expect at least 12 to 1,500 doses a day. So that's what I'm hoping for, and that on short notice. So hopefully that will be the case in a couple of weeks, and then will be ramped up from there. So that's what I'm hoping for.
Yeah, and I would second that. And in addition, Blake, I can really appreciate your concern about the number of people who've been vaccinated. We're concerned as well, so we will continue to advocate for our community members. We have submitted to the state our. We've ordered everything that we've been allocated, and we've said loud and clear it's not sufficient, but other counties are sharing the same thing. So as an example, this week we ordered all the vaccines that we were allocated. And in addition to that, we said, hey, we would like to be put on the waiting list for 20,000 more doses when they become available. So as Dr. Ansor said, it really is all about the availability of vaccines. Santa Barbara County has developed the public health department. We have the infrastructure. We have the community partnership. We are ready to roll as soon as we get the vaccines.
And then could you just describe the need for more volunteers at the Hancock College vaccination site?
So we are always in need of additional volunteers. We attempt to staff our community vaccination site with the staff, but as life happens, we have cancellations, we have last minute changes of plan. So we are always in need of volunteers and have developed a volunteer pool within the public health department, as well as with our county departments, as well as hopefully out in the community with the various entities like the nursing school, like the MA school, like our medical reserve corps. So those are some of the volunteers that we have been utilizing.
And then lastly, for me, 11 deaths. That's one of the highest, at least I've heard, throughout the last few months. Where are these deaths coming from, and what was the cause?
I don't have information on those deaths, unfortunately, at this time.
All right, thank you.
Thank you, Blake. And then next we're going to Tom Bolton with Newshawk.
Thank you very much. A follow-up, I guess, on Blake's question. I'm wondering what do you attribute the higher number of deaths that we're experiencing in the last few weeks compared to what we saw during the peak in the summer?
It's always expected. If you have a certain amount of people that require lengthy intensive care unit treatment, then you unfortunately have to expect that several of those will eventually die. not recover. So if in our peak times in the summer, our highest ICU admission rate was at 35. Now we've had 50 or even more for weeks on end. That is honestly the explanation. We just, if we have more cases, it's really a very simple mathematical equation. We anticipate that from infected people, around 10% might need hospital care. Of these 10%, again, maybe 10% of the hospitalized people, may need intensive care, ICU care. And then a certain percentage of those will unfortunately not recover. And that's why we see the higher death rate now.
So it's really just a magnitude difference with this surge compared to the one we saw in the summer.
Yeah, exactly. It's a magnitude issue.
Okay, very good. I'm wondering also what sort of the outlook for, there are new vaccines that are in the pipeline, and I'm wondering what people should be able to expect in terms of timing for that, as well as what that would mean for the vaccination program.
Yeah, there are fortunately other vaccines from different companies in the pipeline. And I think the earliest that we can expect the next vaccine to be available in the US is probably March. Dr. Fauci may have a little better timeline, but it's still in phase 3 trial, which means anything can still happen. If there's like a bad outcome or something and the trial has to be placed on hold for a couple of weeks, that will delay things. So we are hoping that we will have at least one additional vaccine come March. So it's a matter of weeks.
And it seems like one of the leading ones to come next is a single dose vaccine. What does that mean?
That means that that's the only vaccine that's going to be on the market that is approved for a one-shot dose regimen.
Right, but does that mean that you can vaccinate more people more quickly because of that? They don't need the second dose?
Correct, exactly. Now, the downside is that so far we don't have the exact effectiveness of that particular vaccine. It's made by Johnson & Johnson. It's a totally different mechanism of vaccine. It's relying on a virus carrier, and we don't really know how effective it is. The vaccines that we have right now that require 2 doses are extremely effective after the second dose, 95%. That is really a very, very good scorecard for a vaccine. That's very rare. Just imagine that the flu vaccine is only 50% effective. So we don't know how good the new ones will be. Hopefully they will be very good.
Okay, my last question is, I'm wondering what percentage of the people who have died were in intensive care units, even a ballpark? Are most of the people dying in the hospital intensive care units, or is it elsewhere?
From the more recent ones, more from the intensive care unit. That's my understanding.
So the majority would be there?
I don't have the exact numbers. I'm sorry.
Okay, thank you very much.
Thank you, Tom. Next up, we're going to Laura Place with Santa Maria Times, to be followed by Nick Welsh from Santa Barbara Independent. Go ahead, Laura. Laura, you're not muted. Laura, I'm going to come back to you and go to Nick Welsh.
Hi, thank you very much. I'm a little bit confused still, kind of the broad universe here of vaccine cases. If we're talking about roughly 32,000 vaccines that have been given to the county, does that include or not include the vaccines that have been given via CVS and Walgreens to the skilled and assisted living facilities?
It does not include the federal partnership with CVS and Walgreens to the skilled nursing facility.
All right. And do you have any numbers? How many doses have been given to Walgreens and CVS for county application? And do you have any numbers in terms of how many of those have actually been administered yet and how many have yet to be administered?
Unfortunately, because it's a federal partnership, we don't have that information. We only have information on what we have allocated to our own partners.
Okay.
But
So
you know,
is it,
I
go ahead.
think Nick, last week you asked a question about Heritage House, correct?
Yes.
So I just wanted to give you some good news. Due to our advocacy of our immunization program team coordinators, we did raise that alarm to the state, and we reached out to CVS. And happy to report that today CVS was out there to offer vaccinations.
Well, that's terrific. I just, I'll ask one last question and butt out. But, I would think that, from the track and trace perspective, the assisted living and skilled nursing facilities, in terms of staff and in terms of residents, would be major concern to you guys. Is there any way for you to get information from the Fed saying we've administered X number already? I mean, I would think that would be very of interest.
Absolutely. That is we unfortunately have been asking the state for that same information. We want to be supportive of our community members who are living in congregate settings. And unfortunately, CDPH has heard our concern for the data so that we can hold the federal partnership accountable to giving the timely vaccine so needed by those community members. But unfortunately, we have not been given that data.
Wow.
But I can chime in on that as well. Even though we don't have the data how many vaccines they receive from the federal government and how many they give, we do know that all of our 16 skilled nursing facilities in the county have been vaccinated as of today by this federal pharmacy partnership program. And I'm also happy to report that there was one skilled nursing facility that somehow didn't make it into this program due to some computer glitch, and Marion Hospital reached out and helped vaccinate that particular facility. So that is very reassuring to know. And this partnership can now reach out to, after the skilled nursing facilities, they can now reach out to the assisted livings and other long-term care facilities.
Thank you very much.
Thank you, Nick. We're going back to Laura Place, who is on a different device.
Can you all hear me?
We can. Thank you, Laura.
Perfect. Thank you. So my first question is about the amount of vaccinations that were allocated to the county this week. Just looking at the community dashboard, it looks like it's around 6,000. Is that correct?
It's right under 5,000, actually.
Okay, thank you. And then as far as kind of the gap between administered doses and ordered, when besides the doses that haven't even arrived yet, just considering the ones that are here now, are some of those being held just because they're second doses that you have to wait a matter of weeks to administer? And if so, about how many of the doses we've received are being set aside as second doses rather than going straight into the arms of people?
I can start with that. So when we report the doses on the week, by the week it is first doses, We also have given the second doses to the providers who are ready to offer the second doses to the community members. So a lot of our community members started the vaccination effort in late December. So this is really due time for them to receive it.
Okay. So going back, do you have an estimate of how many are second doses? Like instead of first doses?
We do, and I don't want to give you the wrong number off the top of my head, but that's something that we can email you afterwards. So we do have the number of second doses as well as what we've allocated as first doses.
Okay, I'll follow up with you then afterwards. And also, I earlier when I was talking to some of the spokespeople for the department, it sounds like the county public health department was trying to stay in contact with all the providers to, keep track of how many vaccines each provider had administered and to whom. So I was curious if that communication has been ongoing, and how it's being reported. Are they reporting daily? Are some not reporting, and so there's some gaps there?
We are updating our provider communications on a weekly basis. So on a Monday, we check in with our providers and we ask about their inventory as well as their ask for the week, and we update that on our both. We will be including that update at our Board of Supervisors meeting, as well as updating that information on our website.
Okay. And then last question for me, are you able to give an estimate of how many phase 1A individuals, healthcare workers, etc., have received at least their first dose? Like how many are left to kind of get vaccinated at this point?
I don't have that information, but more than happy to include it in my Tuesday board presentation.
Okay, thanks very much.
Thank you, Laura. Next up, we're going to Fabiola Navarrete with Tu Tiempo Digital.
Yes, hello, good afternoon. Okay, my first two questions are for Dr. Denin, for Dr. Henry Ansor. How many days do we need to wait to start feeling the symptoms of COVID after we get in contact with a person who tested positive?
Yeah, that can vary from person to person. Now, there are people who, when they get infected, have only very mild symptoms. And those symptoms can start a day after or 2 days after what we call the peak, where most people become symptomatic and have symptoms, is usually anywhere between 3 to 7 days. So day 4 or 5, that's usually. So that's why if somebody hasn't developed any symptoms after 10 days, we let them out of quarantine, because by that time, it's very unlikely that they still develop symptoms if they caught the virus.
Oh, okay, thank you very much. Okay, my second question for you, doctor, is are we still using the vaccine, the Moderna vaccine?
Yes, absolutely. We are using the Moderna vaccine and the other vaccine by the company Pfizer.
Oh, okay, thank you very much. And this is for Dr. Van der Reynoso, please. Well, you just told us that people of 60 years and more are not getting the vaccine because the appointments are full. And of course, this is due to the vaccine limitations. So can they still sign up or just wait until you let them know? And if you please can repeat the process to book an appointment?
Sure. I think the easiest way for our community members is to go onto our website, and the link is there, or to call 211 and we have staff available and on standby to be able to assist our staff, our eligible community members. For those who are not eligible at this time, we are asking that they sign up to receive newsletter that will inform the community members when it's their turn. We anticipate when we are ready to offer vaccines to the 65 plus, we will blast that in our communication. So you will hear it in a press release. You will see it in our social media, as well as on our website and at our press conferences and our board presentations.
Okay, thank you very much. That's all.
Thank you, Fabiola. That concludes the questions for today and our press conference. The next public health update to the Board of Supervisors that Dr. Reynoso just mentioned is this coming Tuesday. Shortly after 9 a.m., the board meeting starts at 9. You can also watch live on Cox Cable Channel 20. Go to YouTube at CSB TV 20 or link from the county website at countyofsb.org. The next press conference is next Friday, January 29th at 4:30 p.m. And just to recap some of the information you heard today, for more information and links to the county's public health data dashboard, vaccine information, FAQs, informational videos, the previous press conferences, and more, go to publichealthsbc.org. You can also call 211 from the 805 area code for information or to be connected to the county's call center. Outside of the 805 area code, please call 800-400-1572 to reach our 211. Remember to wear a face covering and stay at least 6 feet away from other people. Wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Stay home and work virtually as much as possible, and only leave the house when necessary. If you feel sick, please stay home. Don't go to work and isolate yourself while you call your doctor or a clinic and follow their medical advice. With that, that concludes the press conference for today. Everyone have a good evening, stay safe, and we will see you next week.